beloved, the importance of us checking our vital statistics, going for routine medical checkup can never be overemphasized. And I don't know, I feel so bad. I saw a patient in my clinic. She was brought to me. She looked very pale, and after clicking her, taking her history, I discovered that she was transfused just last month with 2 pints of blood. A woman of, I think she says she's 51. Yes, she's 51 years old. And in less than a month, she's down again with anemia. And the family had just, that's one thing with Nigerians. You have come to meet a professional, and you are still the one guiding the professional on what to do. The families are just insisting, please, people should transfuse her, transfuse her. I say, transfuse her for what? She's not dying now. We'll first of all do the PCV. Yes, she looks pale. We'll do the PCV. And we're going to do other investigations. The senior daughter said, Ma, there is nothing wrong with her. They say it's typhoid and malaria. I say, oh, that's very good. And why is typhoid and malaria, draining her blood like that? Is she a child? Doesn't she eat? So I told her, I said, from my assessment, I am seeing the possibility of her having a mass inside, because I noticed a little protrusion in her abdomen. And also, madam, you look like somebody who was, on the, fat side before. You used to have weight, isn't it? She said yes. Either you are in a kind of diabetic, chronic stage of diabetes, or maybe worm infestations, because these are the things that one could just think about. So they claim. I said, okay, the hospital you people went to, it was then when Nigerians, we are funny people. Oh, true. After much talk, and when they did the scan, and the scan showed that there is a presence of mass by the the bile ducts around that area, and the pancreas. So I say, you see, then her PCV was just 19%. So I say, yes, before we transfuse, let us even know what is draining your blood. And that was where we saw that from the scan. She did an abdominal scan, which showed that there was a mass. The mass was not clearly defined. So we asked her to go for a CT scan, because I think her PCV was 20%. She can't die immediately now, So, meanwhile, we collected the stool before the scan report. The stool was collected to do a stool test. So the CT scan will now, give a more, because that one have high resonance, you understand, it now give a clearer view of the mass and its location. That was when they now open up that even before the last one, she had high blood before. And I don't know, we are professionals, but I don't know, let me just believe that maybe they went to, or like they were trying to force me to transfuse. Maybe they overwhelmed the person. But excuse me, patients shouldn't toss you around. You are the professional, you are the the person in charge. So they were highly, they appreciated our effort so far. So we gave them a referral to go to Gwagwala Teaching Hospital, University of Abuja Teaching Hospital, Gwagwalada, because that's where they will get, this thing is now becoming a specialty thing, So what are we saying? If she hadn't come to us, perhaps she would have gone back to that place. It was their neighbor who had, experienced us, who had received our service, our services that brought her. They wanted to go again and receive blood as usual. So he said no, that they should bring her to our clinic. And this diagnosis was made. So we encourage her to go to Gwagwalada, and they've left for Gwagwalada. We wish her a quick and fast recovery. So what are we saying? Let us not be doing self-medication, blind treatment. So we just come and tell you, my sickness no dey pass malaria. And that's one thing with us Nigerians. You are the one that came to seek for medical advice or medical attention. You will now still be the one telling the medical person what to do. You have come. I always tell my patient, you have come. Leave us to do what we are trained, what we went to school for. So that you will be happy when we are done with you. So please, it is very, very good. It is important. It is important. The importance of this can never be overemphasized. There is need for us to do our regular checkups so that we can stay healthy and live fulfilled lives. Living our lives, in fulfillment, aging gracefully, aging with health and strength. Check these things so that you will not be taken unawares. I love you, my beloved. I love you, my friends and family. I love you for always tuning into my station, to my channel, and I assure you the truth, nothing but the truth. If you treat malaria very well, take this from me, you shouldn't be talking about malaria for a year or two. Quote me anywhere. If you properly treated your malaria, you did a test and you knew it was malaria, because we have seen cases where people will come, they say they have malaria. At the end of the day, we'll find out that they were stressed up, because from the malaria test will be negative. So we just rest and maybe some supplement or a dietary advice, fruits and vegetables. The people will be fine. So God bless you. Please take seriously your health this year, this season. You, especially you watching me, go and do those very vital, medical screening you need to do. Some of us don't even know our liver function test. Some of us don't even know about liver function test. Some of us have not done kidney function test. Some of us don't know the state of our kidneys, our vital organ. Some have not even done their eye checks. So please, these are all very, very important. Love you and stay blessed. Ciao, ciao.